Okay, thank you everyone and welcome to Introduction to Policy Research Units 2024 to 2028. My name's Helen Stinson. I am a Research Programme Manager working in the Science, Research and Evidence Directorate within the Department of Health and Social Care. The National Institute for Health and Care Research Policy Research Programme will soon be opening its invitation for applications for the 2024 to 2028 Policy Research Units in order to meet the longer term policy needs of the department and its arm's length bodies. The department is keen to boost capacity in policy research, so today's webinar is intended to support interested applicants by providing an overview of the relationship between policy research units and policymakers and sharing more information about the application process. Please be aware this webinar is being recorded and will be available later on the NIHR website. So today's webinar will be presented by Simon Robinson and Leanne Dew, who are Senior Research Programme Managers working as liaison officers between the DHSC and the current Behavioural Science and Adult Social Care Policy Research Units. They will be providing insight into what policy research units are and how they work with policymakers. We will also hear from two of the department's policymakers, Dorian Kennedy, Deputy Director of Children, Families and Healthy Ageing, and Lee Slater, Principal Social Researcher within Workforce Information and Analysis. They'll be sharing their experiences of working with policy research units and the valuable resource that they can offer the policy-making process. Finally, Maria Moroso from the NIHR Policy Research Programme will provide an overview of the application process itself and where you can find more information. At the end of the session, we'll have some time for questions. You can submit your questions by clicking on the Q&A button at the very bottom of your screen. Please be aware that any questions that we don't have time to answer today will be answered in a written FAQs that will be uploaded onto the NIHR Policy Research Programme website. I'll be providing more information about where you can find these at the very end of the webinar. But first, we have a short pre-recorded message from the Chief Scientific Advisor, Professor Lucy Chappell.
If you bear with me a second.
Hello, I'm Lucy Chappell, Chief Scientific Advisor at the Department of Health and Social Care and Chief Executive Officer at the National Institute for Health and Care Research. We know that a sound evidence base is vital for good policy making. Often policymakers find it challenging to draw on academia when forming policy against tight deadlines or in politically charged areas. Within the Policy Research Programme, policy research units have helped to deliver a step change in the relationship between policymakers and academics by enabling access to high quality academics that are at the top of their field, through the flexibility to respond quickly when new priorities emerge, and with an ability to develop trusting relationships to work on politically sensitive areas. Our policy research units are an important research resource in priority areas for health and social care policy. They undertake rapid response work to meet the short and longer term needs of policymakers and provide advice on the evidence base and options for policy development. The Policy Research Programme currently invests in 15 policy research units that cover a range of policy areas across 4 broad categories: system-directed, specialism-specific, life course, and condition-specific. The Department of Health and Social Care is committed to investing in future policy research units to support its policy priorities between 2024 and 2028. These policy research units will help us to meet the competing demands placed on our department, whether that's the ongoing response to COVID-19, supporting our social care sector, or delivering on the government's manifesto commitments and our long-term plans. The department is keen to boost its capacity in policy research and welcomes applicants who have not worked with the NIHR or the Policy Research Programme before, as well as those who have experience of working with us. Thank you.
And now I'm going to hand over to Simon Robinson, who's a Senior Research Programme Manager and lead of the Behavioural Science PRU, to give us an overview of the policy research units.
Thanks, Helen, and thanks, Nick, for getting the slides up. Morning, everyone. I'm Simon Robinson, as Helen has just said. I'm just going to give a quick overview of the context and a broad outline of what a policy research unit is. So policy research units are part of the National Institute for Health and Care Research, which is, as many of you know, a health research system funded by the Department of Health and Social Care and directed by DHSC's Chief Scientific Advisor, from whom we've just heard. NIHR works in partnership with patients and the public, the NHS, universities, local government, and other research funders. It funds high quality, timely research that benefits the NHS, public health, and social care. It also invests in world-class expertise, facilities, and skilled delivery workforce to translate research into treatments and services. It attracts and trains and supports the best researchers to tackle complex health and social care challenges. And it also funds applied global health research and training to meet the needs of the poorest people in low and middle income countries. On this diagram here, you can see research as part of this system on the right, and the upper of those two green boxes is research projects and programs, and that's where policy research units live. Next slide, please, Nick. So the policy research program is one of 9 NIHR research programs, and it funds high quality research. Oh, Nick, you've gone forwards already. Right. High quality research to deliver robust, timely, and accessible evidence to inform policy development and implementation across the healthcare and public health systems. Policy research program research is flexible and open to regular input from policy stakeholders. Often experience of meaningful engagement with policymakers is a prerequisite of funding. PRP research provides new knowledge needed to improve or evaluate services or policies, and ensures findings will be of value to those facing similar problems elsewhere in the health care and public health systems. That is, it needs to be generalizable. Next slide, please, Nick. So what are PRUs in particular? So policy research units are part of the National Institute for Health and Care Research Policy Research Programme that we've just seen. NIHR PRUs are university-based multidisciplinary teams of researchers from multiple collaborating institutions. There are currently 15 policy research units, which are shown here. They provide long-term resources for policy research. They also provide rapid response services to provide evidence for emerging policy needs. And they provide advice to policymakers and analysts on the existing evidence base and options for policy development. Next slide, please, Nick. So what do PRUs do? Self-evidently, they do policy research. But what are we looking for? Well, last time we commissioned, we don't commission individual projects. We commission a range of skills and experience. So we commission expertise in a range of disciplines appropriate to the topic area for each unit. We commission the capacity, resource, and program management to provide the work program and the rapid response facility. We look for understanding of context and needs, in particular, the ability to engage with and understand policymakers' needs and adapt to change. Delivering research that has impact on health and social care policy and service delivery. We look for the ability to work across units with other researchers to increase capacity and capability. We look for an understanding of equality and inequality, that's equality and diversity in research, and also research into inequalities in health and social care. We highly value patient and public involvement and look for a strategy for engaging with patients and public and taking their views into account. And we look for communication skills, in particular, producing outputs tailored to the needs of policymakers, practitioners, and service users. That's it from me. Back to you, Helen.
Thanks, Simon. So now I'm going to hand over to Leanne Dew, Senior Research Programme Manager and Lead of the Adult Social Care PRU, to speak about how policy research units work with policymakers.
Brilliant. Thanks, Helen. And I'll build on some of the points that Simon made there about how we work together. So the ways of working and engaging with our policy research units, and actually projects funded through our policy research programme more generally, are a bit different to some standard research contracts or grants. So we thought it'd be useful today to talk a bit about how DHSC and its arm's length bodies work with the PRUs and vice versa. And the context for this working relationship is that we are all trying to make sure that research, evidence and analysis, and the vast wealth of expertise in our policy research units is feeding into policy making. Essentially, that this investment is having impact. And this requires a really good working relationship between researchers and policymakers, and both parts of that relationship are needed for success. The one certain thing about policy making is that change is constant, which can make research really tricky. But close and collaborative relationship and close and collaborative working can really help to ensure that research remains relevant and feeds in a timely fashion. We all know that the kind of windows of opportunity for influencing policy or affecting change don't often align with research timetables, but there are things we can do to make that more likely. And this happens throughout the research process, from when we start kind of deciding the focus of a research to project design, data collection, and then producing the outputs for a range of audiences that also include policymakers and to effectively communicate findings. So what do we mean by a close working relationship, and kind of what factors make this successful? So we've put some kind of key principles on the slide, and I know lots of you on this call do this already, so apologies if I'm kind of teaching grandma to suck eggs, as it were, but I think it's useful to reflect on these. So partnership, we need to recognise that kind of it's a two-way process, and that both sides of the relationship, as it were, have something to offer to the research process. And I guess also worth pointing out that you won't just be working with, say, policymakers in the department, but there's also a range of analysts, economists, social researchers, statisticians, data scientists in the department that will also be involved in this kind of research relationship. Mutual trust and understanding. So communicating openly and honestly and kind of being reliable is useful for a productive relationship. And this includes kind of being that critical friend or kind of giving us real advice or information about when we think a research proposal or idea is unrealistic, and advice on alternatives. So it's always useful to come with, you know, that's not going to work for this reason, but we could do this instead. Common goals, making sure we're all agreed on what the output or the end result is, and kind of working together to produce research to feed into that. And as I said earlier, realizing that kind of goals or milestones shift slightly, but kind of keeping in regular contact can really help mitigate that as kind of challenges occur. Flexibility. Partnership working is more flexible than, say, transactional contract management. And I think flexible relationships really do help influence policy at the best time. Co-creating policy research. So I guess and I'll come on to talk about this in a bit more detail in a second, but this isn't kind of here's a question, you know, the researchers go away and then come back with an answer 3 years down the line. It's more about working together to design a project and agree a project that works for both sides of the party. And we realise as well that, you know, academics and those based in universities and other institutions have other pressures and demands on their work as well. So yes, policymakers are a really important audience for our PRU work, but we also realise that you might be looking at academic publications and other aspects as well. And then impact. Maximising impact, and that might be about formal academic publications, but it also might be presentations, alternative inputs, outputs, Or it might just be not about a specific research project itself and the final report, but actually offering your expert advice and kind of expert opinion on questions or evidence gaps. And I think what is really unique about the policy research units and why we fund in this way rather than on a project basis is that we gain kind of more than the sum of the parts, as it were, and that we have that enduring relationship, and we can get to know, you can get to know colleagues in the department and priorities and discussions that are ongoing there, and that we build the trust in the academics and in your work, and it can build up over time rather than kind of just being one project where everyone comes together and then disbands again. So hopefully these all sound like good things and useful ideas, but what does this look like in practice when you're working on a project? So I've kind of picked out a few little bits of the research process to kind of talk about these in a bit more detail and hopefully bring it to life a bit. Next slide, please. So when we're thinking about agreeing research priorities, this is about identifying evidence gaps and supporting the development of research proposal to address these. Sometimes suggestions might come from the PRUs and from the academics there, either as gaps identified as part of a different project or something that kind of colleagues from the PRU know is a gap from their knowledge of the evidence field. But often for policy research units, the ask will come from the department or colleagues in our arm's length bodies. And these questions or ideas can be at different levels of research readiness or different levels of specificity. Quite often we want to draw on the expertise in the PRUs to help us shape these research questions and move from a kind of policy question or slightly amorphous idea into a tractable and deliverable research question. So once we've got a research question, we need to agree a project. And again, this is likely to be a bit more of an iterative process to move from initial discussion and idea into an achievable research plan, if I can say it, that works for policy timetables and kind of other stakeholders. So, often there's a discussion around this is what we can do, and we might say, okay, that's going to take a bit too long. What can we do a bit quicker? Usually where we're going to, or actually what we're really interested in is this particular group of stakeholders or people, and kind of work on that until we agree a research specification together. So kind of dreaded words, government and management of research projects. We will agree arrangements for project management of research, which will include, say, progress meetings, updates, dissemination plans. It's much more productive to have regular check-ins over the life of the project to share learning and updates from both sides. There is also governance at the unit level. For example, we have oversight group meetings every 6 months. These meetings bring in a range of stakeholders from the department and arm's length bodies to feedback on the strategic direction of the unit and its work to ensure that we're getting the most for the research and that kind of we're aware of any emerging priorities on the horizon that we need to be thinking about. We also have regular management meetings between the SRE LOs and the unit directors or management team. And I guess it's important to note here that, you do have an LO based in our Science Research and Evidence Department who's here to support you and kind of facilitate the relationship between the Policy Research Unit and the department. And, you have that point of contact and support. And then thinking about the other end of the research process, promoting outputs and dissemination. I'm sure you guys are all familiar with the idea that health research usually takes about 12 to 15 years for implementation to happen. In policy research, we seek to drastically reduce this timeline, with some projects having kind of immediate and clearly identifiable impact, which I think is a really rewarding thing, hopefully, of working on policy research. PRUs are expected to publish findings, so they're open for kind of public examination and peer review. This is government funding, and we want to be transparent with what that's going on, and it's for the benefit ultimately of the people in the UK. So usually involve publication on the PRU's website, but we also completely appreciate that you have needs around academic publications and journal publications, and we'll look to make sure we find publication formats that work for both parties. We do need outputs to be reviewed by DHSC colleagues and given an opportunity to comment ahead of publication, but this isn't to block or suppress findings, but we operate on a principle of no surprises, and actually the feedback from the department could be really useful in kind of improving and developing the outputs. And I think the other thing with PRUs, and I'm sure you're used to this in other projects that you're working on, is that we need to think about different formats of outputs and dissemination plans to make sure that kind of findings are landing with the key audiences, and the keys here are simplicity, clarity, and kind of usability. So that might be a short briefing note, a slide back or presentation, rather than purely kind of peer-reviewed formal publications. And we might be looking at interim findings, emerging findings, or even lessons learned as we go along to make sure that we're feeding in real time. So to summarise there, being part of a PRU is about working collaboratively and closely with policymakers in the department, whilst retaining the kind of independent academic rigour and role of critical friend, expert advisor. It's a different way of working to some standard academic contracts or grants, but the reward is that you get experience of the policy making process and the opportunity for your research to have immediate and rather wide-ranging impact. And I think Dorian and Lee are going to talk on this and some kind of practical examples again to make it a bit more real, but I'll hand back to Helen.
Thanks, Leanne. So yes, I'm going to hand over to Dorian Kennedy now, Deputy Director of Children, Families and Healthy Ageing, to hear more about his experiences of working with PRU units and how PRUs can best work with policymakers to provide policy relevant and high impact research.
Thanks, Helen, and hi all. Very good to be here. I just wanted to sort of echo a bit what Lucy Chappell said at the beginning. I do genuinely feel we are really fortunate as policymakers to be able to work with the sort of the leading academics across the country on a number of research areas. It's a real enjoyable part of the job as well as an important part of the job. So that's something I really value. Obviously, we recognise very much that you are the experts in your research areas, and that's why we need you. I just wanted to say a little bit about trying to help you see our side of the fence and what we need, because I think it's sort of two different worlds colliding a bit. So trying to put yourselves in our shoes, or the shoes of health ministers, put it that way. So our ministers want to ensure that policy is evidence-based and based on good research, and so I think it's really important to have in mind how your research can benefit policy. You know, ministers like to announce things. Ministers want to make announcements about new things where evidence has shown something is working, or a new policy based on new research. So that's really where ministers come from. They want to have those information that they can use. And so if you can think about how can your work get into that level of thinking, that sort of approach, and I think it's really helpful if you can have that thinking when you're designing the work and working on how the work is shaped, as well as bringing your academic expert to it. So we really need to know how can we use the research, and I think we do need to be really honest about it. Both sides need to be really honest. We need to know how far can the research take us? Do we read too much into the research? You know, do we read too little into the research? Are we missing something? I think there's a really important role in with academics providing that constructive challenge, so that we get what the research means, what it tells us, and also what it doesn't tell us. And I think that's really important. So I think there's a really valuable role in that you play in doing that. And that is really about going back to the point, how can we use the research to support policy? I think on that, I think the other key issue I'd really encourage people to think through is communication. You all work on really complicated areas, and you have to communicate a lot with the research on a very non-expert audience, and translating your, the outcomes of the research into language that is still accurate, but it is understandable to a non-expert audience is really important, because the policymakers don't have the technical expertise or the academic expertise that you do, but we need to be able to communicate, or you need to help us in communicating the outcomes of research in a way that is both accurate and understandable to a non-expert audience. I would flag up that I think Leanne said the only constant in policy is change. So I'd very much encourage you to keep an eye out for what some of the wider issues are with government. And obviously at the moment, a couple of issues that are very relevant and topical are levelling up. As I'm sure you know, it's not the most tightly defined term, but I think we can read into it what it means, trying to improve outcomes in some communities, some parts of the country. Also disparities. So for example, the current Secretary of State for Health is interested in health outcomes in different ethnic minorities. Now, a lot of this has come out of the COVID and the pretty stark health outcomes that was seen in some ethnic groups and also in some parts of the population, such as in the more deprived areas. So if you can keep an eye out for some of those wider issues when you're thinking about your research, I think that'll really help us as well, because it'll make you stay a step ahead in the thinking and planning. And again, to echo a point made previously, PRUs work best when the policy teams and the PRUs understand each other and work closely together. And that sort of, as you know, that sort of relationship takes time. It takes openness and transparency and communication. If I'm honest, I really enjoy the research side of the job. It's a real pleasure. So it's something I come to with enthusiasm, and I hope that can be reflected from the academic side in trying to, build that bridge so we really get that close understanding between the policy side and the research side. I guess one final plea of research that comes up with the answer more research is needed is a bit of a bugbear. I'm sure more research is always needed, but again, think about what the policy need is and what ministers can do with the research. If a recommendation is more research is needed, it's really important to say what the research is needed, why it's needed, how far is it going to take us, and when will it be available. So I think you need to get that real transparency and clarity about what work is needed, and to help manage expectations going forward. I'll pause there and back to Helen. Thank you.
Great, thank you, Dorian. And now I'm going to hand it over to Lee Slater, Principal Social Researcher working in the Workforce and Information Analysis team.
Thank you very much. Good morning, everyone. I think a lot of what I'm going to say is going to echo a lot of what's kind of gone before, but perhaps bring it together in one place. And again, talk about, I suppose, what we get from it, the relationship with PRUs, and some experience and some sort of examples of how we've done that. And so you can see sort of tangibly the pipeline then from the problem to the research and then to the impact that it's had. So I suppose what's in it for us? Why do we like the PRUs? I think it's actually been said, but just to sort of hammer the point home, having access to renowned experts in a field at pace is incredibly useful for policymaking. Typically, if you were going to procure research through the usual procurement timelines, that takes a long time. That might not always fit with the realities and the needs of policymaking and decision making. So having that sort of relationship set up with the PRU, incredibly useful. Still getting access to that high quality research, but at a way that is more in keeping with the demands of policymaking. Super useful. I suppose coming from an analytical team as well, sometimes there are bits of analysis, detailed analysis that we don't have the capacity or the capability to do. And so sometimes having the PRU with us on that side can be really helpful, and bringing in wider, for example, labour market or data knowledge, for example, bringing that to bear is very useful as well. What sorts of PRUs organisations have we worked best with? I suppose the main thing to say is PRUs that do policy relevant stuff. So think about the methods that you use. Is that going to result in something that from which a decision could ultimately be made? Or is it's kind of a nice method, it's kind of a cool method, but there's not really an obvious decision that's really going to come from that. So think about methods with that respect as well. And ultimately, if you can put yourself in the shoes of decision makers, that's very helpful. Sometimes you'll be approached with quite a messy ask that doesn't make a lot of sense. And sometimes that won't even be possible. So sometimes it's about saying, and I think as Leanne said, we can't do this, but we can do that. So being creative, being useful, making yourself useful in that way is incredibly helpful. I suppose just as sort of a tip as well, in terms of helpful for us, in terms of the sort of skill mix perhaps of PRUs, I suppose my view on that would be something like, if you can have a range of skills, think about the diversity of the skills in your team. That's really useful for us, because a narrow range of skills effectively means there's certain evidence gaps that we won't be able to fill just because of the makeup of the team that you've sort of brought to bear. So, for example, don't bring 10 economists, for example, just in 10 in your team. Make sure you've got some skills set from different professions and different expertise that you can bring to bear, and avoid groupthink as well. So that's really useful. I did want to talk about just a few examples of work with the PRU, so you can see perhaps some of this in action, and you can get a flavour of the kind of stuff, particularly in workforce, that we're quite interested in as well. So pay. NHS workforce is one of the largest workforce in the world. Pay matters. It's front page headlines every single year, lots of sort of union action as well. So it's really important to understand what impact pay has on other things that we also care about, like recruitment and retention of staff, for example. The problem is we can't do a randomized controlled trial of pay in the NHS. It's not really politically or operationally feasible. So our PRU, they used a creative method, which basically they exploited variations in local cost of living, because pay is set nationally, but you'll have local variations of cost of living, which effectively they were able to measure relative pay and then measure that in relation to other outcomes. And this work found that relative pay was associated with retention. And this has actually been really helpful evidence that we've used in pay negotiations with Treasury and the pay review bodies as well. Just a couple more, just to give you a flavour of the different kind of tasks. That's more of a quantitative one. Sometimes we'll have sort of evaluation needs. So nursing associate was a new role that was brought in a few years back, somewhere between the registered nurse and the healthcare assistant. So we need to evaluate how that's going. It was a formative evaluation, still relatively early days, but we needed to learn how it's going and learn lessons for how we can scale that up. So the evaluation found that whilst the role was being well received generally, there was some confusion about the precise delineation of the tasks of a nursing associate versus other more recognised roles. And so that's really helped to inform our approach as we've continued to scale up nursing associates. And a final one, to give you that sort of political edge to it as well, and some of the messy ministerial realities. During COVID, the then Secretary of State was particularly concerned about staff morale. Lots of suggestions and evidence about staff burnout, for example, particularly in the height of the pandemic. Secretary of State really wanted a new product that would help us to monitor this on top of existing ones that we already had. And so we commissioned our PRU to do a rapid review to understand, look at understanding and measuring morale and how that was done elsewhere, and recommendations for how we might take that forwards. Unfortunately, the reality was morale is measured very inconsistently, defined really inconsistently. And I think the thing that we took from that was a need to be clear about what we mean when we're understanding and measuring morale, and also be clear that it's not going to be a panacea. It will offer some things and not offer some others. So that one shows us some of the more murky and messy realities, perhaps of research and the political realities as well. But it did help us to inform our strategy as we look to monitor morale through the pandemic. And that's it from me. I'll hand back to Helen.
Thank you very much, Lee. So now I'm going to hand over to Mario from the NHI Policy Research Programme.
Hi everyone, thank you, Alan. I'll be very, very brief with this session and caveat it by saying that we are still in the planning phase, but I want to outline very, very briefly the process we are considering for the commissioning of the new policy research units. We are planning to launch the call in summer, hopefully by midsummer, but this is could be potentially subject to change. We are hoping to give applicants a good few months to prepare their outline applications and identifying their partners and collaborators in the process of preparing and drafting the application form. The current deadline that we have in mind is at some point in autumn, we'll have the deadline for submission, and then shortly afterwards, we'll have our shortlisting process. Outcomes will be announced, and shortlisted applicants will be invited to present their proposals to an independent panel of experts. With the opportunity to address any feedback received following the first stage. At that point, we are hoping we'll be able to make conditional offers for funding that will be subject to negotiations and agreeing a full program of work with the policy stakeholders, and will support you and our colleagues in SRA will support you in the process. Ideally, we are hoping to have the process completed well in advance, January 2024, which is the target for starting the new policy research units. So this is in a nutshell the process that we're hoping to go through. It's still in development, we're still in the planning phase, but that's the thinking so far.